Hi everyone, today we're going to look at performance enhancing drugs and revision for the GCSE PE exam. So this is obviously for Edexcel, and the main areas that they typically ask questions for are for narcotic analgesics, diuretics, steroids, beta blockers, erythropoietin, which is EPO, and blood doping. So these are the main areas that come up, and the most commonly asked area is anabolic steroids. So if you're going to revise one particular drug and performance enhancing drug, go for anabolic steroids. So the first one we're going to look at is narcotic analgesics, and when we're looking at this area, and if this exam question comes up asking about it, always put down that they are linked to painkillers, or masking pain, or hiding pain, or helping cope with pain. Pain is the key word for this one. Now, generally, they'll refer to a scenario, and if it is a scenario-based question, they will probably suggest like what type of athlete are more likely to use narcotics, and that would be those suffering from an injury. So exam question could state so-and-so is injured, what is the most likely performance enhancing drug they would use, or vice versa. It might say in which scenario might someone use a narcotic, and that is for when someone is suffering from an injury. Now, why would they take it? And that's where we get the links to performance and enhancing performance. So the types of points you want to be making is it's going to maintain their ability to train. It's going to allow them to continue to play through pain, continue to play in the game, and they can perform at the same intensity as if they were not injured. So they're the sort of three key sort of links to performance that we always want to try and get in when we're looking at any sort of exam question. What's the application to performance? The next performance enhancing drug we'll look at is diuretics. Now, diuretics essentially help the athlete pass urine quicker. Okay, so you basically wee more often. And the reasons why athletes would take this drug is to quickly lose weight. It's a weight loss drug because water's passed out of the system quicker. And in other cases, it's to mask the presence of other drugs. Now, most questions about diuretics will focus on these two areas here, like why would someone take diuretics? And it's these sort of 2 points, so losing weight quickly and masking the presence of other drugs. Now, if it was asking an application of diuretics, why would someone try to lose weight quickly? And often it's to meet the weight category. So a boxer, for example, would be trying to get down to the weigh-in body weight. Okay, so they might train and perform higher than their actual weight category. But when it comes to the weigh-in point, they will try to lose weight. So they're at that point, they're legitimately within their weight category. Other sports where they have weight categories include things like judo, Olympic weightlifting. There's a number of sports that involve weight categories, and athletes might take diuretics if they're slightly overweight and need to get down to hit their weight category. Anabolic steroids is probably the most oftenly asked question about performance enhancing drugs, and sometimes when we see in addition to anabolic steroids, we have these terms peptide hormones and human growth hormones, which essentially have similar sort of traits as anabolic steroids. So I've stuck them in here just to save time. So if we were looking at peptide hormones and human growth hormones, we're really looking at similar sort of impacts it has. So the key thing with anabolic steroids is it allows us to train harder and longer. It allows us to recover quicker from our training and exercise. Now, there are two key things. You can train hard, you can train long, and you can recover quicker. Why does that happen? Well, because when we're training, we're going to experience hypertrophy. So there'll be quicker hypertrophy, i.e. muscles are gaining in their mass and getting bigger muscles quicker, therefore increasing our strength and power. Now, the application to performance is quite straightforward. Usually we want to say that there's typically they use boxing, or weightlifting and sprinting as the main sort of athletes who typically use anabolic steroids because of the strength and power side of it. But any athlete who wants to train more frequently, or the impact on their performance is, if their sprinter was to take it, it means they can train more frequently because their recovery time's quicker, and their body is able to cope with the amount of training, which is what anabolic steroids do, allowing the muscles to get bigger because they're training more. Now, peptide hormones, human growth hormones, have the similar sort of impact, i.e. they are increasing muscle mass, strength and power. And I've put on the screen an exam question that you could probably just pause and have a read of, just to see the application, but that is linking here to peptide hormones and human growth hormone, as well as anabolic steroids. Now, there has been an old mark exam question, and a 6-mark exam question. We don't tend to get 6-mark exam questions, but it doesn't mean we can't see a 9-mark exam question. And it was a discuss-based question, and discuss questions want to know what the benefits are, or why someone might take them, the anabolic steroids, and why people should avoid taking anabolic steroids. Now, if we think about the slide just beforehand, they were the reasons why people would take them: to recover quicker, to get stronger and more powerful, and hypertrophy, and train longer and harder. They're all the benefits of taking the anabolic steroids. The disadvantages are on the screen, and they are as so. So first one is aggression. So people who take steroids tend to get, we used to call it roid rage, but people get angry and aggressive because the hormones, the testosterone, etc., are affected by the anabolic steroids, and that aggression can help. The impact on performances can lose focus, and therefore drop your performance because you're not focused on what you should be doing. You're just more focused on the aggression. Other aspects, it creates liver damage, and obviously in later life that can lead to a further disease of the liver. And essentially it's cheating, it's against the rules. So those who are caught using anabolic steroids, usually by random drug tests, are likely to be banned. So that's sort of like the other side of it. And if it was a 9-mark exam question, you might say, well, what do they do? As the first 3 marks, the sort of a review of anabolic steroids, the advantages of taking them, and then the disadvantages of taking them. But remember, we're linking in the impact it has on performance. Okay, we're moving on to beta blockers, and this is a performance enhancing drug that typically people tend to get mixed up with diuretics. Please avoid that at all costs. Beta blockers is lowering the heart rate. That's the drug that basically reduces your heart rate, makes it go slower. And then the knock-on effect of that is that it impacts your anxiety. So beta blockers will allow anxiety to decrease. It can reduce muscle shaking and tremors, and it tends to get used in sports that are more precision-based sports like archery and diving. They're the exam board questions, sort of examples that they use. Diving with the anxiety of the high dive, for example. Archery, any sort of movement in the hand, the tremors or shaking in the hand, even the heartbeat can create a slight movement that can affect the accuracy of long-range shots. So archery needs to have a really controlled, calm, and controlled body when they release the arrow. And we get to EPO, erythropoietin. You will never really get asked to spell that word, so just refer to it as EPO. It is another peptide hormone. It's a naturally occurring hormone in our body, but what athletes do is they inject it into themselves, and it has this impact on performance, and it's very similar to blood doping, which I'm going to cover in the next slide. So it increases your red blood cells. That's the first thing it does, and the impact on that means that we're going to get more oxygen to our working muscles, because the red blood cells in the hemoglobin are carrying oxygen. That oxygen is then transported to the muscles in the bloodstream, gives us energy, and we've said this over and over again, more oxygen to the muscles means you can resist the fatigue, you can work harder and longer, go faster for a longer period of time. Depends on the situation you're talking about, but they're sort of key sort of terms that you want to be incorporating into your answer for the impact on performance. The scenarios that the exam board tend to use are long distance events. Don't put running. You have to mention long distance running. I would suggest things like marathon is a better example than saying running. But long distance cycling, as you see, Tour de France, a marathon, which is naturally a long distance run, and a long distance swim. Those athletes need lots more oxygen in their red blood cells to get to their working muscles, and EPO increases the amount of red blood cells, meaning there'll be more oxygen available. And finally, we get to blood doping. Blood doping is the process of removing the blood from an athlete. So an athlete will use a syringe and take the blood out of themselves. They will then freeze that, store it, and freeze it. In the period between competition and the point they've taken their blood out, their body replaces the lost blood. So their red blood cells go back up to whatever the resting levels are. When it comes to the point of competition, the athlete will then thaw out the blood and re-inject it back into their body. So all they're doing is they're taking their own blood out, freezing it, and then when the body's regenerated that blood, they inject their initial blood back in and they have more red blood cells. And that's the process of it. And if we think back to EPO, it's exactly the same thing. And this is quite a good one to revise, linking to EPO as well. Is it increases red blood cells, more oxygen goes to the working muscles, can resist fatigue, train harder, longer, run faster for longer, etc. And the sports examples that we're talking about is for long distance events. So they're your main performance enhancing drugs. One that I haven't really talked about is stimulants, and that hasn't been asked in an exam question. So is it likely to come up? Possibly. I think if it does, it will be a very short answer question, which basically stimulants are going to increase someone's alertness, and maybe events like Formula 1 drivers might use them, but many team athletes will use stimulants as well, like caffeine and things like that, to increase their alertness and focus on the game. So good luck in your exam. If performance enhancing drugs comes up, I'm sure it will, because it tends to come up every year. But yeah, good luck.